Thank you, everybody, for joining us today. I'm so excited about the Nursing Now Challenge now having a strong student focus. When we first started the Nightingale Challenge back in 2019, we had lots of interest from students all over the world that wanted to be part of this early career development opportunity. But to be honest, then we didn't necessarily have the time or capacity to do it. But because we've had so much demand from students all over the world, we've now made sure that students are hardwired into the work we do in relation to leadership for early careers. And I'm so delighted to say that we've got the privilege of having Professor Sheila Clow as our sort of student ambassador. Sheila has got an amazing career and is so inspirational as a nurse leader in so many ways. But I think really helpfully for us, Sheila was the co-chair of Nursing Now and really understands the power and potential of a global nursing social movement and the importance that it plays in terms of raising the status and profile of nurses and midwives all over the world. And that starts with students, and that starts in universities and colleges and schools of nursing. So engaging and connecting all of these training institutions and getting them to think about the leadership development of the future workforce, I think is just so very exciting. So thank you so much once again for being here. And truly, Sheila, thank you to you for sticking with us and being our champion for the students. We're so privileged to have you. And I think it's now over to you. Well, I don't know if, have I frozen, or I don't know if Sheila has frozen.
Let me mute myself, and I'll try to be brief because I don't know I'm frozen. Yeah, our students, and to say that I empathize with you because I was a student here a long time ago. I'm in third year, fourth year. This was in the 70s before any of you were born. So, however, being a student has always been, something that I remember, something that I've always cherished. And indeed, as Professor Lisa has said, to improve universal health coverage by raising the profile and status of nurses and midwives. But we knew that in order to sustain it, we needed the Nightingale Challenge to ensure that now we focus on students. So it's really great to be able to see you. But at the same time, I want to really thank my colleagues, Professor Lisa, Bailey Spratt, and your colleagues for for this initiative, because somebody had to take it up and ensure that we engage universities. And I'm really proud, I'm really excited to be a champion for this initiative. But now, the great news is I am the Chancellor of the Botswana Open University, a newly appointed Chancellor. So I was able to invite my colleagues here in town, the quad as far as ICA is concerned, really regulation, administration, the education, and of course the nursing union. A lot of my colleagues, I think they are on right now. And the great part is that all of them are my former students. So they know that I've always wanted a lot of to be leaders. So yes, they are leaders. Really, that have this, but I look forward to working with them at home here. But I know with their powers and their excitement, Hexacon. So with great talk, you tell us what your aspirations are, and I think we will glean it. So with that, thank you very much, and let's continue. Thank you.
Fantastic. And just to say, Professor Sheila, sometimes the signal hasn't been great on this, but what we will do is we will get a recorded video of you and replay it, because I think it's so important that all of our students hear your passion, your expertise, and your commitment to this agenda. Thank you so very much. And I think now we're over to our
Thank you so
keynote
much.
speech from Jill White. And I think this is via video link from Australia. So over now to Jill, who is another amazing nurse leader that's backed the Nursing Now Challenge from day one. So over to Jill.
Hi, it's my absolute pleasure to be able to be involved in this webinar. My name is Jill White. I'm a Professor of Nursing and Midwifery at the University of Sydney in Australia. We are currently in hard lockdown with COVID still, although around the world we are at such different positions in relation to this dreaded burden that we have all carried. One of the things about having experienced the COVID pandemic is that nursing is now seen in quite a different light. We're seen not only now as associated with hospitals, and I think we've been pushed into that sphere quite a lot, but it's been absolutely apparent to everyone that nurses are important for home care, they're important for hostel care, they're important for quarantine hotels, they're important for giving vaccinations, and that those vaccinations and for COVID testing, and they take place anywhere that people are. And it's a really interesting return to nursing roots, really, that the public sees nursing now as taking place wherever it's appropriate that care is provided. So in many ways, whilst we would never want it to happen, it has shone a light on nursing in quite a different way than I think we had been moving in the public's perspective in the past. And this is really important, I think, for universities and for students to take hold of this. I think many universities had narrowed their programs to be very hospital focused, very acute care focused. And we understand now, absolutely categorically, that nursing is as much about public health and epidemiology as it is about acute care, care of ventilated patients, care of people in intensive care units. So we need to grasp this opportunity and absolutely take hold of the whole of nursing. One of the probably more unfortunate parts about, many unfortunate parts about COVID, but one of them, I think, is that it has also shown us that nursing is not particularly well positioned politically to have influence on national health policy, on funding arrangements, on service provision decisions. And this is where I think as students, you guys have so much to offer us into the future, that you have an opportunity while you're at university, whether in your pre-registration program or in advanced learning programs, to grasp hold of trying to understand the political positioning of decision-making in healthcare and to look at the ways in which nursing can have greater influence. We are the bridge between the community and health services. We know so much more than any other health professional group about the effect on individual patients' lives and the cumulative story of that. And so for you as students, whether pre-registration or post-registration students, to understand the need to be involved. And that involvement in policy making can be at a very local level, it can be at a national level, you can be members of parliament, and in fact in many of our countries now we do have nurses who are members of parliament, and they're making incredible differences to the way in which the conversation happens about health. But whatever level you choose, whatever level's right for you, you can be sure that your nursing perspective enables you to ask questions in a way that other people do not. So whether it's a conversation in a local politician's office, whether it's a conversation at the childcare centre, whether it's a conversation with your neighbours, your perspective can make a difference on how the community thinks about healthcare, how politicians think about healthcare, and how people vote about healthcare. So you've got a big job to do, a very important job to do, not only to bring your expertise to nursing wherever that may happen, but to bring your expertise to the conversations about broader healthcare issues, and to make sure that that perspective, that patient-centred, patient-focused, person-focused perspective is put to those who are most influential in holding the purse strings and in making the decisions about what sort of healthcare is provided, where, when, by whom, and for whom. We really understand social determinants of health. And so we know that currently the healthcare is not being provided to those who need it most, in the places that they need it most, in the way they need it most. And we have to make that well known. And you are in a fabulous position to start that conversation. So I wish you well.
Well, as ever, fantastic words of wisdom from Jill White that influences healthcare at many levels, from the bedside right through to the policy level in Australia and beyond. So I know, Jill, you can't be with us today, but thank you very much for that, and we'll no doubt catch up with you again soon. So we're now going to move on to some really interesting presentations, which are from academics actually, that have been leading or have led nurse education programs for many years. And it's my great pleasure to start with a dear colleague of mine that I work very closely with, and that's Professor Rosie Neefsey, who was recently the head of school at Coventry University, but now has moved into a really exciting position of leading a research centre for healthcare that we certainly hope, Rosie, to have a strong global focus, don't we, moving forward. So Rosie, over to you.
Hello, everybody. Thank you so much for inviting me to speak today. It's absolutely wonderful to be in the company of so many students and other academics who are interested in leadership in nursing. And I hope I can share with you some interesting ideas and activities that we've been doing at Coventry. I wanted to touch on three main areas, and I know I haven't got very long, and so I'm hoping that the hosts will stop me if I overrun. But I want to talk about what we've been doing in relation to undergraduate nursing, and then I'll touch on our master's level nursing provision. Then I want to move on to talk about the Centre for Care Excellence and how we're using leadership to develop excellence in practice. And then lastly, I want to give you a flavour of some of the work we're doing with two key global partners in relation to leadership development, just to give you a little snapshot of what we're doing here at Coventry. So if we can talk about undergraduate nursing. So when we started designing our nursing curricula, there's so much to cover. In the UK, we have very high standards that come from our Nursing Midwifery Council and lots of competencies and proficiencies that students have to fulfil. But what we really wanted to do was develop this idea of leadership from the very beginning of an undergraduate education as a progression from year 1 through to year 2 and into year 3 and beyond. And we were thinking about leadership in terms of the actual impact with your individual patient. What can you do as a nurse to lead care, to make sure it's safe, to make sure it's compassionate and person-centred? And so one of our first learning outcomes in our nursing degree is to actually show leadership in relation to patient care at the individual level. But it's really important as well that we develop nurses as leaders in relation to services and in relation to teams. And so we also introduced this concept of the nurse as a leader and a collaborator in relation to service improvement, and this idea that nothing can stay the same and that we must respond and adapt to our changing society, our changing populations and our changing needs. And nurses are really important leaders in that change process. So in our undergraduate degrees, we really focus on the student nurse as being an active learner. It's really about being independent, about being a thinker, about asking lots of questions and not accepting just what we see on the surface, and really thinking about where can we as student nurses and as leaders make a difference. Now, the way we've tried to do that in our nursing degrees is to really challenge our students with lots of different types of assessments. I'm sure our students don't thank us at the time, because we do challenge them to do some interesting assessments, group projects, presentations. We ask them to take part in simulation activities and practical exams, and to think about how they can actually design and improve our services. So, but it's not just about what students do in university. Of course, we want them to develop leadership skills in practice. And so in this slide, what I want to show you is that this idea of progression. So in our degrees in England, typically students will do some theoretical modules and go on to do practical modules of between 8 to 12 weeks, where they're part of a nursing team in lots of different settings. And what we want to do is develop our students' idea and their identity as a leader. When the students first go into practice, those students are at foundation level and need a lot of guidance and support. But you'll see the second arrow is in second year, where we're looking to students to start to manage their own caseload and actively participate in giving and providing care. By third year, we're really looking for our students to become quite the leader in relation to their patient groups, practicing independently with quite minimal supervision. And so what we hope is that by the end of our degrees, our students have moved from, if you like, the novice to the expert in their course. Now, some of our degrees are 3 years, some are only 2 years, and that's for students who already have a degree. And so we expect the speed of development to be quite a lot faster. Now, what I want to touch on next is how we continue to develop leadership through master's level education. Now, this is very much a snapshot of one module in our MSc Nursing, which is an online nursing degree. And one of our modules is all about service improvement for healthcare. And students learn all about change management theory, plan, do, study, act cycles, and look at the theory of leadership, the theory of change management. And that culminates in some really detailed analysis of how we change practice. And you can't quite see the link at the bottom, but this module is an open access module. And I was looking at the statistics on who's done this module. So we had it opened from 2018 as part of our online MSc in nursing, and it was open access like a MOOC. And we've actually had 150 nurses study this particular module. And those nurses are from India, Nigeria, Pakistan, China, Saudi Arabia, Iran, Nepal, Sri Lanka. And I just think it's absolutely incredible. We have nurses all over the globe who are looking at how they can lead their services, lead their teams, and influence service redesign and delivery. And it's incredible the impact that education can have on nurses' ability to lead change. So that's the sort of emphasis on education and how we try to develop leadership through our education. But the next phase I want to talk about is how, as a university, we're trying to bring about leadership in the interface between research, education, and practice. practice. So if we move on to the next slide, I want to talk about our new Centre for Care Excellence. And you'll see two pictures there. We've got a picture on the left of one of our university buildings and a picture on the right, which is one of our big acute hospitals. And what we're doing with our collaborator, the hospital, is we've set up the Centre for Care Excellence for nursing, midwifery and allied health. And what we're trying to do through that is bring together leaders from across both organisations. And if you move on to the next slide, Andrea, you'll see that this is the vision. What we're trying to do is bring together academics and clinical healthcare leaders to work together on research across the NHS, that's our National Health Service, across our universities and other partners, to make the links between education, research and practice development. But the main focus is actually making a difference to patient care. And we've actually jointly appointed 5 staff between the university and the hospital at professor level, spanning nursing, midwifery and physiotherapy at the moment. And we hope to grow that team so that we've got even more capacity to lead change and excellence in practice. And we've got a number of objectives. And one of the main objectives is to build this sense of a community, this enabled culture where nurses, midwives and other members of the team from the allied health professions really feel empowered and enabled to change practice. Because practitioners on the ground can see what needs to be done, can see the problem areas, the questions that we need to answer. But we've really got to create an opportunity for practitioners to influence research and education. And by doing that, we can make a difference to patient care. What we're trying to do as well is use the research and the practice development that we're doing through the Centre for Care Excellence to impact on our teaching and learning activities. So sometimes people criticise university level education and say it's not related to practice or it's not real life. And what we want to do through the Centre for Care Excellence is make sure that that real life practice and those challenges and those research topics that we're trying to explore really feed back into our undergraduate and master's level education. The other thing that we're doing through the centre is making sure there's a career pathway between universities and clinical settings, because that's really how leadership will happen, where you've got the meeting of the different worlds and environments, and our leaders in education and research able to interface with our service delivery. And all of this hopefully is a way of supporting excellence in nursing, midwifery and allied health. So hopefully that gives you a flavour of our Centre for Care Excellence. What I want to touch on now is the other work that we're doing with 2 key global partners. And it's really exciting because we can see the link between undergraduate education for leadership, master's level education for leadership, research and clinical practice, and the need to lead around the world. We're working with North Macedonia at the moment, and you know, the first speaker was quite right. COVID has shone a light on the need for nursing to really take centre stage. And we're looking at the reform of education in North Macedonia and raising the profile and opportunity for nurses. And really the main way of doing that is promoting the concept of leadership and nurses as leaders. The next project we're looking at is working with Somaliland, which is incredibly exciting. And again, this is about developing leadership capacity for practitioners who are at the coalface of practice. So we're trying to develop work to support midwifery leaders and practitioners so that they can roll out their own train the trainer model and implementing a buddying programme between the UK and Somaliland. Now, I'm a little bit out of time now, but I hope it gives you a flavour of some of the leadership opportunities for nurses and midwives across the globe. And there's so much impact that we can make through education, research and development. Thank you.
Thank you so much, Rosie. That was really comprehensive, and I think it just shines a light on the power and potential of networking, of working with and in different countries, and certainly I think a great addition to the Nursing Now Challenge is that ability to network academics, researchers and practitioners together so that we can really strive for global excellence in everything that we are trying to achieve. So thank you so very much for that. It was great. We're now going to move to Melvin, and Melvin is from PES College of Nursing and is going to talk to us about the work that you have been doing. So welcome, Melvin, and thank you so much for joining us.
Thank you, Professor Lisa, and it's my privilege to be here to share my experiences along with my students, what I'm doing right now at my college. So it's a great privilege for me as well as my students to part in the global forum, as well as to part of the Nursing Now campaign, our challenge. And we start with, we had a great inauguration on the Nursing Now Challenge last year with the candlelight procession along with the celebration of 200th birth anniversary, and followed by that. And we have the student-focused programs. In that concept, we had first grouped the student in a different groups, like every group has a small proportion of students, and they will be having their own mentors, and every student have the opportunity to lead as a leader. I mean, have the opportunity to have a leader on the group, and they will be coordinating among their peer groups and getting involved in all the activities planned for the student development. And followed by the grouping, we had mentor meeting for all the mentors, student mentors. And during the meeting hours, we will be discussing on further week programs and activities and all of that, and any new innovative ideas from the student mentors or even from the students. And we will be discussing on the meeting. And after the meeting, we will be having a group discussion along with all these students. During this lockdown period, we have an online platform. It's great to have it, and keep regularly. We will be having a student-focused session on that, and we will be discussing both their personal development and career development, as well as their curricular activities. And the team activities, which focusing on their curricular development, the curriculum-related activities, as well as some activities which is participating on the global activities. Say, for example, we plan to participate in UN Global March, which represented the global warming and this awareness campaign, and we have enrolled for that, and we are planning on that. And kind of activities, and every week it differs, and we will be doing also. And we have a career talk shows. Since we are doing this particular program to the final year students, and we have career talk shows where they will be oriented to the different scopes of nursing and different, for example, defense services and railway services, how the nurses are plays role on that, and what is being a nursing offices, what is our role, and what leadership activities they are doing in all other sectors. And we have the career talk shows, and there we will be discussing so on. And all these we were planned, these career talk shows for coming weeks we have planned. And the students, especially the mentors, given a chance to conduct researches, the student-focused researches, which is funded by the university. And the students are conducting researches on vaccine awareness among the general public and different teaching methodologies and various, the several topics. And each of the student mentors are conducting those researches on that. And like that, we have the planned activities, and our plans keep on changes based on the need, whenever the new innovations are coming, right? So during those times, we will be just keep on looking those happenings, and we will be adopting to that. And and we will be having a regular meeting on that, and making those students get involved in all of these activities, and making them to participate. And it's my happy to say that one of my student now going to participate in this panel discussion. She was very happy to participate in that, and even many of my students are really to participate, and we if any chances they may participate, as well as they are ready to write a blog on their experiences and so on. And once we adopted to this particular Nursing Now challenge, our standard and our viewpoint towards the global activities entirely changes. And even we had several contact with the global nurses to see what happens around us, and as well as to put the student, my student, in those their self into the global forum. And it is a really great opportunity to shine their life out, shine their careers and futures. So it's really wonderful. I think many the students from across the globe are attending this particular webinar, and definitely I'm sure that this would be the great start for all the students, and all the yearly adopters of this Nursing Now challenge should take initiation on various activities and kind of webinars. We will be sharing our experiences, what we are doing, so that it will be helpful for other yearly adopters to take new messages for this. So this is what my experiences along with Nursing Now challenge, as well as with my students and so on, is there to go on. Further proceeding, further plans are lot more are there. That's what.
Yeah, that's wonderful. Thank you so much. And I absolutely agree that engaging students into this global community early on is going to be really enjoyable for so many. Because actually, one early career nurse said to me just the other week on a session like this, that global problems are often local problems, and local problems are global problems. So the more we can get our students thinking global and acting local, and actually feeling part of a bigger solution, and having the support and power of us and a community behind them, then I do truly believe the world is all of our oyster. So thank you so very much for that, and we really appreciate your support. So now we're going to move to Mount Kenya, and Elizabeth and Debbie have done some amazing work over a few years now in really strengthening partnerships between Kenya and the north of England, and they've just grown from there, really. So I won't steal your thunder, Elizabeth and Debbie, but over to you, and many congratulations on your hugely successful partnership.
Thank you so much, Lisa, for the wonderful introduction.
Elizabeth, we're just struggling to hear you. Is there any chance you can turn up your sound at all?
Okay, let me try. Just a moment.
I think that's better, Elizabeth.
You are able to hear me right now?
That's better. Yes, thank you.
Okay. Elizabeth is my name. With my colleague Debbie, we are going to share with you about what we've been doing for our Nursing Now challenge through the International Junior Nurse Fellowship. So I want to talk about Mount Kenya University, and then Debbie will share more about the program, and we'll keep on changing as we've been doing. So Mount Kenya University is a chartered university, and it's a regional hub of training, research, and community engagement. The university has 6 campuses, 8 open, distance, and electronic learning centers, 3 marketing offices across the region. It has 4 institutes, 1 academy, and a center for professional development. Mount Kenya University has 4 country offices located in Kampala, that is in Uganda, Agesia in Somaliland, Bujumbura in Burundi, and Garowe in Somali. So we are based in Kenya, in Thika, in Kiambu County. So the university has over 30,000 registered students, of whom 3,000 are international students from over 30 countries. So Mount Kenya University is a member of Association of Commonwealth University, and it has been named as a hub for United Nations Academic Impact Strategic Development Goal 10 on reduce inequality, and there is a link for more information. You can go through it. So I'll talk about our College of Health Sciences, where School of Nursing is housed together with Medical School, School of Clinical Medicine, School of Public Health, and School of Pharmacy. As the previous speakers have said, we cannot just do nursing alone, but we have to combine with also the preclinical sciences, also to look at the public health issues, and also look at the medications we give to our patients. So we are happy to be part of the college. And next slide. Yeah, and now I want to share about our School of Nursing programs. So we have a PhD in nursing that goes for 3 years. It is thesis only, but we are hoping we'll start course content also, so together we can do thesis together with course. We also have masters in nursing with midwifery option, medical surgical nursing option, critical care nursing, nursing education, leadership, and management. And we also have our Bachelors of Nursing program direct entry and Bachelor of Science Nursing upgrading through distance learning for those adult nurses who want to upgrade to degree nursing. So nursing in Kenya is done. Our degree nursing course goes for 4 years studentship and then 1 year internship. That is normal for all Kenyan university. So Mount Kenya University is a private university, and for us, we do trimester-based system where our students will have to do their theory together with their practice, and they do theories with skills, nursing skills simulation from first year, second year, up to their third trimester. So at their third trimester, they go to the hospital now to exercise or to practice on real patients. So next slide, kindly. So for the clinical practice, our students go for 4 rotations and they do 6 assessments. You will realize that for us, as a nurse in Kenya, once you get enrolled and you're registered as a qualified nurse, you can either work as an adult patient nurse, a pediatric nurse, or a midwife, or even you can go into management, become a clinical instructor in clinical teaching, or you do community nursing or mental health nursing. So for our students, we try as much as possible to follow the Nursing Council regulation and ensure that they rotate in all these areas so that once they qualify and they do their licensing exams, they are able to practice in any of these areas. So in their first rotation, they rotate in medical and surgical wards, and then they are assessed on nursing care of an adult patient and nursing care of a pediatric patient. So in their second rotation, they go for the maternity rotation. So they go from antenatal care clinic to antenatal ward. They do mother in labor, where they go to the labor ward and deliver mothers. That is through the normal spontaneous vertex delivery. And then they do postnatal care and also taking care of a newborn. And at least we can work as midwives and also as clinical nurses. So in their third rotation, our students, they are exposed to leadership. So as we teach, we also try to ensure that it's not just being a clinical nurse who does not have leadership skills. So in their third rotation, we take them through leadership process, and also we try to help them manage a clinic or manage a ward for some time with supervision. And it is amazing, as you will hear from the experiences of my students, what they've been able to do. And we also take them through clinical teaching because we want them to pass their knowledge. So clinical teaching in terms of educating the patient so that we can empower them and reduce the in-stay in the hospital and also the readmission. And also then educating other students, like peer clinical teaching, like they teach each other. So that in the future, maybe once they qualify, they can also act as clinical instructors. And actually that's where I started, and I'm so grateful that I went through this system in Kenya. So in their fourth rotation, they go for the community rotation. This is actually the longest rotation our students go through, around 19 weeks. So they rotate in the community in rural health facility to learn how to work with the community and also to do some of the preventive measures like immunization, and also do community diagnosis, also do school health, nursing, and many more while in the community. Still in this rotation, they go for their mental health rotation, and they work with mentally ill and psychiatric patients, and they're also assessed on how to take care of a mentally ill patient. Next slide, please. So now, having had a background of Mount Kenya University, I'd want to invite Debbie to talk more about the International Junior Nurse Fellowship Program, and then I'll come back and continue with the presentation. Debbie, kindly.
Thank you, Elizabeth. So in July this year, Mount Kenya University and Bradford District Care Trust were delighted to be able to launch their International Junior Nurse Fellowship Program. That's a 12-month program that we're delivering in partnership for some leadership development for our early career nurses. We all share and we learn together on a virtual platform. At the core of all of this, though, is a robust mentoring approach. So we have a golden thread running through the program to support our early career nurses to flourish. So we want them to question, we want them to innovate, we want them to inspire, and we want them to be able to facilitate learning in others. We also want to increase their confidence. So we want to look at their professionalism, their engagement, and their collaboration across the 12-month period. So we do have some specific modules looking at these things. We develop them as looking at themselves as a leader. We want them to look at organisational change and resilience. And we're also looking very closely at the global health agenda that previous speakers have touched upon. So we've already shared experiences about what it's like to be a student nurse in Kenya and what it's like to be a registered nurse in Bradford in England. We've also looked at the profiles for our respective countries as part of the World Health Organization State of the World's Nursing Report, which was really interesting in terms of sharing opportunities, sharing challenges. And like Lisa said, we've got lots to learn from each other on a global perspective, lots of commonalities. Also, in terms of the pandemic, we've brought in a full-day module looking at anxiety, loss, and resilience. Thank you. Also, a golden thread running through the whole 12 months is around the evidence to practice. So every learner on the programme will be developing their own piece of qualitative research. They'll be developing a robust research framework, and they'll be converting that into a conference poster presentation as a minimum. And we're hoping then that all of the people on the fellowship will be delivering that poster presentation as part of the International Nurses Day in May 2022. Next slide, please. Thank you. So who are our first cohort? They're made up of 10 senior student nurses at Mount Kenya University, either third or fourth years. We've recently recruited 2 student nurses from Bradford University who are final year adult nursing students. And then from Bradford, the remaining people in our cohort are early career nurses, some across different areas of nursing. So we've got community mental health, district nursing, we've got dementia assessment, and also we've got other community roles as well. Thank you. Next slide, please. I'll hand back to Elizabeth to talk about the research that our learners are doing.
So thank you so much, Debbie, for that. As part of our International Junior Nurse Fellowship, every participant is supposed to come up with a research proposal, and go through the whole process, do implement, and also share results. So for my 10 students from Mount Kenya University, we have Christine, who is looking at factors influencing delivery of care, perception of nurses, nursing leaders, and healthcare consumers. So there is Grace, a third-year student, who is looking at exploring Kenya nursing student experiences on theory to practice gap. Number 3, Gladys Wairimo, who is looking at nurses' perspectives on barriers to diabetic self-care, a case study of Vika Level 5 Hospital in Kiambu County. And I don't want to continue reading all of them, but I just wanted to give you a gist of what our students are doing. So if you look at the research topics, they are current issues that students are going through. And they've majored on looking at the issues students go through as student leaders and also as early career nurses leaders once they qualify. They also want to look at how they can help once they understand the theory to practice gap, how they can improve nursing practice once they qualify. And an interesting research topic here is for Marlene and Ashura. So Ashura wants to look at, to do a qualitative study and explore on challenges people living with hearing impairment and power of speech while accessing health services in Kenya. You realize in Kenya, we don't have any department of disability or people who are born differently. And I think they have been going through a lot of trouble trying to access healthcare services. And she hopes once she's able to explore these challenges, she can be able to develop a module where nurses will be trained on how to take care of people who are born differently or people with hearing impairment or power of speech while they seek care in the health facility. For Marlene, she's looking at exploring challenges faced by homeless people. So for us, we have a name, we call them chokoras. These are children who are born in our street and they don't have anywhere to go. And unfortunately, we don't have homes for homeless people. So she gave me a story behind why she wants to do this research. And she said once she was working in the hospital and she found a homeless person sleeping beside the hospital bed. And he had a fracture and he could not access any care. No one was assisting. So she decided to take care of that patient. And with that, she felt if she can explore what they go through, then maybe it can guide policy and practice so that we can support them. Next slide, please. So these are the researches for our early career nurses and students from Bradford. So we have Paul. Also, his topic is very interesting. We always laugh and discuss about what we would go about it if it was in Kenya. And then he said he's very passionate and he'd want to look at the mental health of LGBT plus community, which is very interesting because for us, we may not know how to go about it. We hope that we'll have, maybe in future, we'll be able to speak and be able to talk about these without issues or anything. So it is quite interesting to us as Kenyan and also even with my students. So Emma and the others, they are also, most of them are looking at mental health issues, which are pertinent issues in healthcare. But I wanted to pick Natasha. So Natasha wants to look at use of Foley's catheter with female services users with dementia. So we have noted as a fellowship that we are interested with the mental health of our patient and also mental health of our colleagues and also students. And all our research currently rotate around mental health issue and community health nursing, which is very interesting. So next slide, Andrea. So we'll share some of the memories we've had during our past workshops. As Debbie have elaborated, we've been able to do 3 modules. So these are memories and messages from our participants, which are very interesting. I felt it is important I share with you because like Lillian said in August that, okay, so maybe we can look at what Ashura said. Today has been the second day of the start of international, okay, I don't know what's happening, but it's okay, it's okay, Andrea, it's okay. We can move to the other slide, it's okay. Yeah, that one. So I wanted to pick this one. What Ashura said, and it touched our heart. Today has been the second day of the start of the International Junior Nurse Fellowship Program. I am excited about this 11-month program and positive that my fellow members and I will learn a lot from it. Special thanks. Then she mentioned something very important, and I think that has been the spirit of this webinar, that education, research, and practice are very important. So she said, manifesting that the research to be done won't be the kind to be shredded and stored in the cabinets for years. They will impact our society massively. And that's what we are hoping. So seeing such messages from our participants gives us hope that our leadership program is working so well. So next slide. Yeah, next one. Yeah, so we did share our experiences with our colleagues from Bradford, and we learned so much as student nurses in Kenya, because the way, like especially on community health nursing, we were amazed that every person is registered to a general practice. For us, we don't have that. And it is so amazing to know that there are programs that are happening in the world. And as us being part of this partnership, we can be able to share our experiences with our policymakers here in Kenya. So anyway, we are so happy that we are doing this. And I know even with the next modules, we learn a lot. Next slide. Mm-hmm. So now, at International Junior Nurse Fellowship, we empower nurses to flourish. So flourish is our motto, and we say F stands for foundation, that this is a foundation we are giving to early career nurses and nursing students, working together to harness their leadership, their research skills. And we are saying it is an opportunity for us to learn together as nurses. And we have that motto of nurses together, no one left behind. And we hope that this will be a holistic process again, so that we can be able to merge education, research, and practice. Next slide. So thank you so much to our partners, and thank you so much, Nursing Now. Lisa, back to you.
Oh my goodness, Elizabeth and Debbie, I'm almost tearful. I think the partnership that you've forged and the work that you're doing together and the shared learning, it's just so powerful, isn't it? And the opportunities are just endless around, I don't know what's going to come next. And looking at all of those nurses doing research so early in their careers, or indeed at student level, has got to be the way forward, so that nurses and midwives can step into the research and evidence-based building world with confidence, but be able to quickly apply it to practice and what they do. And I think if we can get in the front of that, then actually we can be some of the leaders in the world for implementing and designing and developing research that really does have a massive impact. So thank you both so very much. I so enjoy following you on Twitter and hearing about the work that you're doing. It's just an amazing innovation, and I think it should be replicated all over the world, if at all possible. So well done both, and just keep going. And anything we can do with Nursing Now Challenge to support it, the art of the possible is absolutely within what you've been doing. So thank you both so very much. And we're now going to move to Emory University, and that's Lisa and Nell, I think. So over to Lisa and Nell from Emory University. What a treat it is to be engaging with all of these different education settings. Thank you ever so much. Over to you guys.
Thank you so much, Professor Lisa. It has been a pleasure to be listening to all the schools today and joining you today. Andrea, do you need me? I can share my slide.
Yeah, that's fine. If you can share, that's perfect.
Okay, awesome. And I'm just going to go over some opportunities that Emory University gets to offer these students, as everyone has mentioned, all over the world, and just want to share the things that we are doing at Emory. Hopefully everyone can see that, not really sure. Okay, hopefully everyone can see. We just want to talk about Emory School of Nursing, and we're so proud to be part of the global movement to support the nurses and midwives as leaders, innovators, and advocates for healthcare transformation. And like Nursing Now, the Emory School of Nursing is working ambitiously with health employers as well as partners and colleagues across industries and sectors to create the novel leadership development opportunities for nurses and midwives. I would like to talk a little bit about our Lillian Carter Center, which is named for President Jimmy Carter's mother, Miss Lillian, and has a rich history of educational practice and research offerings. It has been at the School of Nursing and dedicated in 2001. And we define the global health broadly, encompassing both global research outside of the United States and local research in the United States with the immigrant and vulnerable communities. The LCC ensures that global research and health, service learning, and social responsibility are infused throughout the curriculum and educational experience for our students. We've also started implementing our speaker series for the Nursing Now, so we're very happy to join the Nursing Now Challenge again this year. And we've started our series with a leadership-focused guest speaker series, which just features a presentation by Nurse Alice, a respectful nurse expert in the media, PR, and communications on how nurses of all career levels can leverage media to drive change in healthcare. And if you're interested in researching Nurse Alice and asking some questions, you can find her at asknursealice.com. We also like to share our Emory Nurse experience. We're also building a pipeline of innovation leadership-focused courses for our online continuing education library, which anyone will be able to access, called the Emory Nursing Experience. And the first one in the series is the Data Science course for nurses, which is currently undergoing production and will be available in the next couple of months. E&E coursework is provided by the Emory Nursing Professional Development Center, an accredited provider of continuing nursing education. And this is helpful when E&E nurses around the globe have access to evidence-based coursework developed by Emory's world-class faculty, designed to not only help licensed nurses fulfill their requirements for license renewal, but to further their careers with varying certifications and continue to provide the high-quality patient care at the bedside. We also like to introduce, we have a new building, our Emory Nursing Learning Center, and we are in the process. It is currently open. We are still currently building it, and it is 70,000 square feet of space for nursing discovery, exploration, and innovation. And it is going to design to enable innovative interdisciplinary nurse leadership in close collaboration with our practice partners and communities around the globe. Example of the spaces that will facilitate nurse-led health system transformations include the Innovation Hub, lots of AR, VR rooms for full immersion in real-world leadership scenarios, smart connected simulation spaces and classrooms so that people can join in collaboration from anywhere, and interprofessional collision spaces, to name a few. So we look forward to sharing that in the near future with everyone. We're also currently, during COVID, they opened the Hatchery, which is located on the Emory University campus. And it is an innovation for all nursing students, as well as all students on campus. It's positioned with unique ecosystem for nursing innovation, carefully built network of partners who are helping to empower nurses with bold ideas. The Hatchery, an early concept incubation center with a maker space, which provides seed funding to students, and the Emory Healthcare Innovation Hub, which builds academic practice, industry, partnerships, Emory Healthcare, which among other advantages help us to ensure The nurse lead transformation projects align with actual health system needs and partners, and collaborators in technology, and businesses like our Share Care Inc. and Cozetta Business School and others, as I mentioned earlier. We will currently today have a student on our panel, and I look forward to hearing Kat Diamond and maybe possibly answering questions and how she's a student at the School of Nursing. So I just want to highlight to end my presentation, a student, Morgan Clark Youngblood, a DNP and nurse midwifery student, who has worked with nurses and midwives globally to support refuge, migrant, and young populations across access to reproductive health services. And at Emory, Morgan has collaborated with the LCC, the Emory Global Health Institute, and the Emory Rollins School of Public Health to advance midwifery and nursing workforce training and examine more effective utilization of technology to expand traditionally underserved populations' access to maternal health services. And I want to thank you today for inviting us to attend, and I'll send it back to you, Professor Lisa.
Thank you so much, Lisa. That's great. And I'm really excited to see your new building. You'll have to send us some pictures and keep us posted around that. It looks amazing. And thank you for being part of the Nursing Now Challenge. And I think the other bit for me is around harnessing all these amazing nurse and midwifery academics and being able to think about, imagine the power of our knowledge collectively and what we could offer the world with some of those amazing innovations that you talked about. So really grateful to have you here. Thank you so very much.
Thank you.
And now we move on. I don't know how we're doing with Sheila because I know her IT was playing up earlier, but Sheila has agreed kindly to moderate the panel discussion. Sheila, how are you doing? Can you hear us? How's your signal going?
Hello, yes, Sheila is here, but I'm going to switch off the video because the strength of the signal is just too low. So okay. Am I audible?
Yeah, we can hear hear you beautifully.
Okay. So let me thank our keynote speaker and the various how leaders who were able to share with us how they're doing the leadership and how there is that influence between research and practice. And indeed, as our keynote speaker said, I can paraphrase here by her saying, health is actually a political choice. So that we need our students to be leaders who can see themselves where they are, at least the various levels of leadership, including the political office. I always say that to nurses. When we were trained, we were told that politics, nursing is apolitical. There is nothing like that. You may not align yourself with any one political party, but you need to be involved because health is a political choice. And we want nurses to be right there to also participate in politics. So if any of the ones that I'm going to be dealing with right now, if any of you is inspiring, aspiring to be a politician, do get in touch with me. I'll be able to give you that inspiration. So anyway, I'm now getting into the really great part where we are going to look at the importance of beginning leadership journey before nurses even become practicing nurses and midwives. And I have a great panel. I am asking them, what does leadership look like to you? But with that, actually in the Q&A, there is somebody who asked, how do you measure leadership in our students? How can we know that our program is developing student leaders and how that it is successful? So I'm hoping that these great leaders can be able to answer it for us. Now, the first person is Catherine Miner, University of Derby. So I'll hand it over to you, Catherine.
Hello, Professor Sheila, and thank you so much for having me here. I'm Catherine Miner, and now I trained in Kenya as a registered nurse. I did a diploma in nursing, So it was quite nostalgic to hear Professor Lizzie go on and on about the various things that we do as students of nursing in Kenya. But then again, when I came to the United Kingdom in the year 2019, I decided that a diploma was not enough. I was going back to school to study nursing, Bachelor of Nursing Studies, honors degree at the University of Derby. And that's what I've been doing as I work as a registered nurse in the United Kingdom. So to answer your question, Prof, how does nursing leadership look like to me? Now, this is the thing. When I was in Kenya, especially, we used to say that nursing is a handing over process. I know so many people are used to that statement, that nursing is a handing over process. Now, I keep on asking myself, why do we only have to hand over tasks and not qualities and not values? So for me, when we come to leadership in nursing, it is actually about handing over those values that we share, that resilience to practice, that commitment to patient-centered care. That is what leadership looks like to me. And I will also go ahead and say, at the University of Derby, when I started, I took a module in leadership in health and social care services. Now, this module was quite fundamental for me because I've always been what we call an informal leader when it comes to my nursing career, but this module actually fashioned me and it prompted me to accept formal leadership roles. I was able to become to accept the role of being a vascular access link nurse because I'm a dialysis nurse where I work, and so many other things. And I have also become a nurse mentor. So I will say that this formal training in class, coming to realize that it is not all about, clinical nursing. You also have the leadership aspect of it. This has been quite fundamental for me. The other thing that I will say when we talk about leadership, Prof, is actually followership. I've come to appreciate the value of followership. Yeah, we all talk about nursing and we all want to be leaders, but I keep asking myself, so who follows? And this is the fact that we are all good leaders are as good as their followers. So we also need to continue cultivating a culture of followership, emphasizing that we need star followers, because if we have the vision bearer in nursing, in a team, as a team leader, if you're the vision bearer, you need people to support you. And these people, you're going to influence them. They will be able to, come with you wherever you're leading them. So these are some of the things that I can continue, saying that they've shaped and they determine how I see leadership when it comes to nursing. When we come to the pandemic, Prof, we have continued to see nursing, and very much so at this particular moment, from the time the pandemic hit us, and now we are talking about vaccination. And in the UK, we are talking about booster vaccines right now. Nursing has been on the spotlight. And what I keep asking myself is, where is our voice as a nurse? Because now the world is listening, the world is ready to listen, but are we really saying something that is worth listening to? So these values that we are inculcating in our student nurses and, adult nurses like myself, where are they? Are we leveraging the media today, to drive our agenda as nurses, and to say that there is nothing like just a nurse. There is nothing in the world that is called just a nurse. We are all registered nurses, professional nurses who are trying to do the best that we can to bridge the gap between the community, and the health services. We are that missing link. And if you're not strong as a profession, then I believe we are just going to collapse the healthcare system. So this is what I would say when it comes to leadership. And this would be my answer, Prof, as to how leadership looks like to me. Thank you.
Thank you very much, Catherine. And we actually have done it in less than 4 minutes. So it's really great. I'm hoping you have set the example for the ones who are coming, namely Gladys Wairimu from Mount Kenya University. We just had a great presentation. So confirm that for us, Gladys.
I hope you all can listen to me. I'm audible enough. I will say this.
So go ahead.
Pardon?
There is an echo ladies. But go ahead, how it they'll help you to solve it.
Okay. I hope the echo has reduced. I'm Gladys Soilimu Mshiri, a third-year student currently in Mount Kenya University. And my answer to this question on how I view leadership in nursing as a student, I will talk in a capacity of being a student. So when I joined Mount Kenya University, I was still very fresh, and I was elected as the class representative. And for me, I've gone through so many challenges, and there are ups and downs during the leadership that I've gone through right now. I've found a difference between being a leader at the primary level and the secondary level. But as a student, leadership has really shaped my look at things. Like, I can give a difference of how I managed myself in secondary school and how I'm managing myself right now as a nursing student. Being in the clinicals has also helped me so much, because I still took up tasks of leading my other students in the clinical areas, having nurses in charge who, you get these understandings that are good to you. They are mental to know what you're doing or how you're moving on in the clinical areas. And one thing I would say, up to this part, I'm thankful because of the IGNF, International Junior Nurses Fellowship, because it's a mentorship program that was started by, I would say, Madam Elizabeth and Madam Debbie, who are here with us this evening. Because now through them, I was now able as a person to know my standards as a leader in nursing. They have mentored us through, especially in how we should plan ourselves, in how we should balance between our education and leadership. And for me, I would say it is still a journey. I'm still walking. I'm not yet there to really say that I'm very good in leadership yet. So for me, I would answer and say I'm still on a journey of being that nurse leader that I would want to be out there in the field. Yeah.
Thank you. Yeah. Thank you very much. You shared with us the challenges and the milestones in the leadership journey. So let's now hear from Lillian Carrara from the same university. So Lillian, we'll hand you over to you. Over to you, Lillian. You can start.
I think Lillian is not with us. Maybe she's having, oh, she's here. Go ahead, Lillian.
Good evening, everyone. Lillian Carrara. I am a fourth year nursing student from Kenya University. And I'm so glad to be part of this team.
Yeah, I think the connection is bad. Is not good there. I know mine is bad, but it's not too good. But you know, we do have limited time, so let me go on to somebody who can also share.
I'm so sorry, I'm having some connection issues. Here, nursing student from Mount Kenya University, and I'm so happy to be here today. How I will answer you, Prof, is how does nursing leadership look to me? So for me, leadership to me is about competency, is about advocacy, and is about being confident. That is how nursing leadership looks to me. If I walk through my journey of leadership, okay. If I walk through my journey of leadership, I joined Mount Kenya University in 2018. And at that time, I was elected the class president or the class representative. And that is how my leadership started. So through it, we went for several meetings, conferences, and there. And I'm so happy to announce that I'm so happy to say that we were among the founding member of the student body in Kenya.
Okay. Yeah. Thank you very much. Thank you very much. Lillian. So let me get to this, Ashura Toha from the same university. I'm hoping that you'll have a better.
Yes, so hi everyone, is my connection okay?
Yes, go ahead.
Okay, so thank you. So for me, I think leadership is about being a servant. When I think of leadership, I don't think of leadership as you being like, you're the one who's supposed to say everything, or you're the one who's supposed to do things without listening what others have to say about it. So when I say you have to be a servant, you have to be a servant in so many ways, by leading with example, by participating in all the things that you advocate for them to be done. So I think it would be a great thing if everyone took leadership as servancy and not just the authority or being a big person bigger than the people who you're leading. So if we take leadership in that manner, I honestly believe that things are going to change, because when you have that servancy in you, you're now going to be able to employ all the qualities of a leader without having any issues. You'll be able to be compassionate, you'll be able to be a listener, you'll be fair without having any issues. And if I might say this, in Kenya, we have a lot of corruption among our leaders. So if they took themselves as our servants and not just our leaders by taking advantage of us, I honestly believe that they wouldn't be as corrupt as they are right now. So leadership in nursing, honestly speaking, since I joined my campus, I've not been able to be a leader in any group or any organization, but I've seen how other people are leading, and I've seen leadership in so many ways from different people. And I think I'm the follower. I think someone, this first girl who talked, I'm sorry I've forgotten your name, but she was talking about the fellowship bit of it. And I think I'm one of the followers, and I'm happy to be one of them. So thank you so much for this opportunity. And I hope everyone who is a leader is going to employ the idea of servancy in them. Thank you.
Thank you very much, Ashura. Now we need politicians like you. So maybe you should consider being, yes, a follower, but okay. That's where you're good lead. Yes. So now let me hear from Gloria Peter from PES College of Nursing.
Hi everyone, my name is Gloria Peter. I'm final year UG student from India. I'm really honored to be the part of this Nursing Now Challenge student focused webinar. I'm so glad that I got an opportunity to learn from this platform as well as to share my experience as a UG student. We all know that nursing is a divine profession which helps the whole human race in their good times as well as in their bad times. As a student of PS College of Nursing, I am much benefited to build my talents, my professional skills, and also my professional values. Even though it's a professional college, being in the middle of this pandemic, our college and faculties try to make sure that we are receiving an unforgettable educational experience. In bigger ways, I still remember that the candle lighting rally that conducted on our college on Florence Nightingale's birthday. I still remember that it was a great experience for us. And it's reminded me that a good nurse is like a candle. It consumes itself to light the way for others. I'm really proud to be a nurse, and I'm really proud to choose this unique profession as my profession. Leadership quality is an inevitable part of our profession. To boost that, our college has a good strategy. Our class made into 10 groups. Each group has one mentor who is also our friend itself, and I'm one of the mentors. I got 10 mates as my team members. Really, it is an entirely different experience for me, and it helped me to understand the friends as well as to know me completely. And what I done is I helped them in academic as well as in extracurricular activities, even though it's a daunting task. I believe that the key for a successful leadership is influence, not by authority. So I try to influence my friends, all my qualities. I try to by showing my qualities, I try to influence them too. So being a mentor or being a leader, my objective is to help my friends, those who are doing poorly, to do well, and help those who are doing well to do even better. For that, what I done in my team is we conducted a friendly chit chat and made everyone to be an active member in team. We motivated each other and appreciated in their achievements, and also they appreciated in my achievements also. We helped each other, we respected each other, and given chances for them to take remedies, and helped them to, and given chances for them to solve the problems also. Whenever we get a chance, whenever we get a task, or whenever we get a activity, I didn't commend it or I didn't order them to do the task. Instead of that, I shown them how it's done. We also maintained a interpersonal relationship with each other. When I conclude all these activities, mostly I try to create a leader for my team instead of creating a follower.
Okay, Gloria, I think wrap it up because you've passed all the minutes that we gave you. So yeah, wrap it up, my dear. Yes. Go.
Excuse me. Can I continue?
Yeah, no, go ahead and finish. Yes.
Okay. And also our college maintained a regular mentor meeting guided by our teachers. And this meeting has a crucial part in expressing our views, our ideas for a better learning experience. We had a good coordination among the mentors. We share our doubts and together we find solutions. And we got an opportunity, a golden opportunity to participate in state level UG research. This made a paramount role in improving my self-confidence. There are some more opportunities are waiting for us and we are ready to utilize it. It is clear that all the well-planned activities in our college help me to be self-confident. And now also I'm speaking in this platform, and my teachers found a good leader in me and improved my self-esteem and knowledge and made me updated. I enjoyed all the moments, including this wonderful moment also, and I'm eagerly waiting for the next chance. Thank you.
Thank you very much for sharing with us all the way from India. We really appreciate that. Now, the very last person is from Emory University, Kat Diamond. Okay, I can.
Hi everyone. I guess that what I can say, through the Lillian Carter Center, I was able to do a service learning opportunity through I was able to go to our safety net hospital. I was able to go to a free clinic that serves immigrant populations here in Georgia. I was able to do a lot of things. And the best thing about it was seeing nurses in other fields, seeing nurses do social services, seeing nurses be executives of organizations, seeing nurses do politics. And it just blew my mind that there was a place for us beyond the bedside. As Lisa spoke earlier, we have an innovation hub here on Emory's campus. Through that, I won a grant to have something I call the Earthseed Midwifery Initiative, which is a mobile midwifery service. Georgia, where Emory is located, has a lot of rural parts of the state that don't have anyone to provide OBGYN services. So my idea was to bring these services to the people. And through the Hatchery, our innovation lab, they provided business background for me, consulting services. It was great. And I would just like to impress upon everyone that a nursing degree is the beginning of possibility. It is a way to make a way out of no way. It is a way to insert yourself into the grander conversations going on around the world right now. With a nursing degree, you can do anything. And I'm so proud to be a nurse. Thank you.
Oh, thank you, Kat. I'm also very proud to be a nurse. So that's you and me right there, and I know we will change the world. Now, in the question and in the Q&A, there are actually two. One is a comment for Professor Rosie, and then one for Professor Nefsi. So I think you both can type them in there because I know we have run out of time, but there are no other questions. But for me, it's just to thank all of you for really inspiring us and to end up, just a word to you to say, health is made in the community and in the family. Hospitals are for repairs. So as you do your nursing care, your nursing duties, your nursing leadership, just know that leadership also should start right there at the community. And it will really save you a lot of hassle, because once the community is healthy, you will have very few people in the hospitals, in the clinics. So with those words, let me just thank you, my leaders, and to take it over now to Professor Lisa so that she can close for us. Thank you so much.
Well, thank you so much, Professor Sheila, and all of our participants and those listening today. I just want to say it's been such a privilege to be with you all. I'm really excited about what the global student body and the educators that are associated with them will bring to the Nursing Now Challenge. I think the opportunities are huge, and by galvanizing all of our support, our expertise, our common passion to really build universal health coverage everywhere in the world, I'm sure we can achieve amazing things. So please keep connected, keep engaging, and look forward to our next time together. Thank you very much.
Thank you.